Hello, my name is Dr. Vicky Cleak and I'm a consultant psychiatrist with a special interest in adult ADHD. And today we're going to be talking about comorbidity with ADHD. So let's get into it, shall we? So what can we say about ADHD and its comorbidities? There is no doubt about it that if you've got ADHD, you have got an increased risk of developing a number of physical and mental health problems. And today we're going to touch on some of these and think about why that might be. Absolutely love this Venn diagram, which when I first saw it, thanks to Katie Higgins-Lee, thought was such a powerful diagram illustration of the intersection between ADHD, autism, but also giftedness and high IQ. Because if you've got a high IQ and ADHD, it can really ameliorate the presentation, because those people who are not just bright but have a higher IQ in the range of Mensa kind of level of IQ have often struggled socially anyway when they're growing up, because they don't really have much in common mentally with their peers. However, being bright, they can often work out what they need to do to fit in and cope despite. And so that includes, in terms of ADHD, noticing the differences that they have with other children, reflecting on them, and also putting into place strategies that might be helpful. Now, those strategies may or may not be functional, but the point is that being highly gifted can make it much more difficult to identify ADHD, and the same with being on the autistic spectrum. This Venn diagram, if you look in the middle, shows you those differences from people who are neurotypical that are held by all of these differences. So being more emotionally sensitive, having sensory differences, that could be either under or oversensitive to visual or auditory stimuli. They have unique ways of learning. They can be intensely curious, having executive functional difficulties, and being divergent creative thinkers are all things that are held in common with these three issues. If we look at the overlap between ADHD and autism, you can see that stimming can actually happen with ADHD, but I think the reason the person has for doing it behind it isn't so much that it's to reduce anxiety, but it's to get rid of that overactivity in a way that is perhaps seen as more socially acceptable. Those with ADHD can present more typically thought about as an autism trait, those atypical social interactions. So those with ADHD may, because of problems with attention, not notice cues of other people's emotional states. And so they can be seen as quite narcissistic because they're only thinking about themselves. But that's because they've got so much going on in their heads. They're so distracted by what's going on internally and externally that they don't notice what's going on necessarily with those around them. In fact, those people with ADHD are receiving messages from everywhere all the time. They can't necessarily dampen those down and restrict them like an average person can. And that's why they may present with atypical social interactions. Equally, in terms of just ADHD and overlap with giftedness, those with ADHD, those with giftedness both get easily bored. Now, the underlying reason is different from the giftedness. The people who are gifted tend to get easily bored because that intense curiosity, they've absorbed all the knowledge they need from it and they move on. Whereas those with ADHD move on because they found something else that's more reacting to them or moved on, they got fed up with it. It's a different underlying reason for that being easily bored. Those who are gifted and have got ADHD are more likely to think in a symbolic or metaphorical way, unlike those who are typically on the autistic spectrum, and their learning is very non-linear. So, you know, anyone with ADHD will tell them that they don't think in a straight line. It's the same with those who are gifted. They have much more branches, whereas I think with ADHD they're sort of seeing the whole, and they can't again narrow down their attention to the one linear way of thinking about something. So comorbidity with ADHD is common, both in terms of other neurodiversity, other mental health diagnoses, and also associated physical difficulties. So in terms of neurodiversity, if you have ADHD, you're more likely to be dyslexic, you're very likely to be dyspraxic. So did you struggle to learn to drive? Did you struggle to ride a bike? Do you hold your tennis racket or guitar in a sort of caggy, different way to other people? Do you have problems in hand-eye coordination in writing letters? I know someone with ADHD and dyspraxia who could not, as a child, draw squares in nursery, and so whenever they did a drawing of a house, it had round windows. It seemed very peculiar, but when you understood why, it became completely understandable. Dyscalculia, so problems with maths, is much more common, and being on the autistic spectrum as a comorbidity is very common too. So up to 14% of those who've got a diagnosis with ADHD are found to have comorbid or autism. And just so you know, if you've got autism, you're even more likely to have comorbid ADHD. So the take-home message from this is if you've got a diagnosis of ADHD, it's also really important to ask about and screen for all of these other neurodiversities, because they are managed potentially in a different way, and particularly with autistic spectrum disorder, in terms of medication, you may make some very different decisions around that, specifically because people who are on the autistic spectrum often respond very differently to medication for ADHD. So it's only relatively recently that books have come out about the intersection between having ADHD and being on the autistic spectrum. Up until relatively recently, you weren't allowed, in terms of the DSM criteria, the ICD criteria, to have both as a diagnosis. You either had one or the other. But I think it's become increasingly clear that you can have both, and that if you have both, then you may well have your own particular difficulties. The reason I've got this diagram here is because if you have ADHD and you've also got comorbid autistic spectrum disorder, you are to some degree in some form of balance. So ADHD is typically associated with wanting novelty, difference, not being able to keep still, being a social butterfly, being impulsive, making silly mistakes, being scatty. Whereas those who are on the autistic spectrum are very much typically seen to be liking order, disliking change, finding that very uncomfortable. And so if you've got the two inside you, what happens is you've got a bit of a tug of war. Now that can present as a tug of war, but it can also present as a kind of holding hands and a support, so that the autistic bit stops the ADHD running amok, and the ADHD bit stops the autistic bit being too pedantic, too inflexible, and not wanting to change. The importance of knowing about this is that as with a three-legged stool, if you take one of those legs away, I tell my patients this, when we're considering medication and for the ADHD bit. If you take away the ADHD bit, what happens with the three-legged stool is that it falls over. And so what can happen then is you get an exacerbation, an uncovering and an exacerbation of the autistic traits. And I've seen patients who, although we may have sorted out some of the ADHD symptoms in terms of the overactivity, in terms of them not being able to concentrate and focus on their job, they then stop going out and socialising and become quite anxious, more anxious about social interactions with others. And that's because suddenly they're able to pay attention to all those things that are different, that can make someone who is on the autistic spectrum feel quite uncomfortable. There is a tendency to overthink when you're on the autistic spectrum, and if you've got comorbid ADHD, that tends to happen at a rapid pace. I call it overthinking on speed. And when you treat the ADHD, you find that the pace of thinking can reduce significantly, but that can lead to increasing ruminations, thinking in loops, which can be experienced as quite difficult for the individual. And sometimes when you've got a patient with you who's got both, understanding that before you start tinkering with the ADHD and treating the ADHD is can be really vital, so that the expectations are appropriately set for treatment, and we can start looking out for these changes. And you may find that, as with some of my patients, that you need lower doses of medication, and that the person themselves needs to find that balance and work out for themselves what is going to be the right middle ground for them. And that's going to be very different for every single person, and depending on what job they do, and I think also their underlying personality and character, as well as the surrounding supports for them. So what about the risk of having other mental health diagnoses? So again, we know that if you've got a diagnosis of ADHD, you're much more likely to have a comorbid anxiety disorder and depression. I see many patients who have been treated for years for depression, when actually the underlying problem is the ADHD, and once you've treated and managed that, they don't get depressed, and they don't need their antidepressants anymore. Sometimes it can be quite difficult to tease apart whether a person has got anxiety. If they present to their GP talking very fast and explaining this kind of buzz in their body, they can't keep still, then that can be seen as anxiety if not thought about and considered in more depth. And so again, the person gets inappropriate treatment for that. I can't keep track of the numbers of patients I've seen who have had numerous courses of therapy, counselling for their depression, anxiety disorder. It's never worked because they can't pay attention, can't do the homework in between times, because all these things are very difficult for those with ADHD. And I always say that therapy is a bit pointless with patients who've got ADHD until the ADHD is treated, because then you're much more likely to engage with treatment through psychotherapy, and it's going to be much better value for time and money. There is an overlap between bipolar affective disorder and ADHD. There have been concerns that some of the stimulant medications can tip somebody with ADHD who's got an underlying vulnerability of bipolar affective disorder into having a bipolar, a hypomanic episode. And indeed, for those with a family history of it, or anyone who's got some hints of that in their history, you need to be very careful and monitor any medication carefully. However, it doesn't exclude treatment of ADHD, having a diagnosis of bipolar. When I was a junior doctor, I can think back to my early psychiatric practice, where I saw a number of bipolar patients, female patients, who just didn't quite fit with that diagnosis of bipolar 2, who actually I think had now I'm pretty sure they actually had ADHD, and they were probably, well, they got the wrong treatment because that hadn't been identified before I knew about it. Emotionally unstable personality disorder. There is a general discussion going on in psychiatry, psychology circles about whether there is such a thing as emotionally unstable personality disorder, or whether in fact the presentations we see can account for a combination of ADHD, being on the autistic spectrum, but also PTSD, complex PTSD. I have to say that I do think that there's something to that, and certainly I've seen a few patients who have come for an assessment who have previously had a diagnosis of emotionally unstable personality disorder, but actually have come from quite stable backgrounds. There's no indication of any childhood sexual abuse or other trauma, and actually they've got ADHD, and that emotional intensity and instability is not a part of a personality disorder, it's their ADHD plus or minus their hormones. Alcohol drug dependency, much more common in those with ADHD. I always ask about drug and alcohol history, but particularly drug history. Sometimes you find that people have been self-medicating when they were younger through the stimulant cocaine or amphetamines. I always ask what drugs somebody's taken and the effect of it on them. And what you find very commonly, particularly in those just with pure ADHD, is that they tried cocaine, but they found it was either a waste of time, or that everyone else seemed to get very excited and it didn't really seem to affect them in that same way, or when they took it, they actually managed to go to sleep and their mind calmed down. And that to me is also a good indicator about whether they're going to do well on stimulant medication for the ADHD. Eating disorders. There is a 3 to 6 times increased risk of having an eating disorder. More commonly, you get binge eating, which is a bit of a problem with impulse control, and I think that's very common in ADHD. It's the same with alcohol use, either self-medicating to try and get to sleep, or to help sort of calm that overactivity down internally and externally. Cannabis misuse is much more common in those with ADHD. Again, often I find that people use cannabis to try and help their sleep, and the same can happen with caffeine, that they find that if they use caffeine, a lot of caffeine, caffeinated drinks, it can act on sort of similar receptors and have a paradoxical effect on them in helping them feel a bit calmer. Those with ADHD are much more likely to smoke cigarettes and find it much more difficult to stop. So in terms of a physical comorbidity with the underlying drive being ADHD, these problems are often much more frequent in those with ADHD. So that initial insomnia, you can't get off to sleep because your mind is racing, can be a significant problem. I would also say that delayed sleep phase syndrome seems to be much more common. So their circadian rhythm is out of kilter with everybody else, as though they're living essentially in another country's time zone. So they want to go to sleep later and wake up later. And of course, if you have that problem, but you live in a country which doesn't match with that circadian rhythm, you are chronically going to be sleep deprived because you have to get up for your job starting at 9 o'clock. You can't lie in, but then you still can't go off to sleep later in the day. So you constantly feel jet lagged. And I've seen that with patients, and it is relatively easy to treat if you identify it. It can make a huge positive impact on their mental health as well as their ADHD symptoms if you get it treated and managed well. Obesity, because those patients with ADHD are often snackers and overeaters. They get it in their mind and they then can't stop. It literally is the Pringles advert of if you pop, you can't stop. You've got to eat the whole thing. You've got to drink the whole bottle of wine. It's really common with the patients I see. Underhydration. So those with ADHD forget to drink, and particularly in childhood, they're much more likely to be constipated. I think there's a significant number of children at clinics with constipation who've actually got ADHD, and that obviously can lead to long-term kidney problems as well. Gambling, being in debt because of overspending, not managing your money correctly, not thinking about the long term, prioritizing your finances. Sexual health problems, so those with ADHD are much more likely to have a baby outside of a relationship due to sort of forgetfulness around using contraception, as well as perhaps having more sexual partners because you get bored with the relationship you're in and move on to another one. Act impulsively, much more like to have road traffic accidents and accidents more generally, as well as having a forensic history. So there's a number of associated comorbid social difficulties people with ADHD have. In summary, having a diagnosis of ADHD means that you're much more likely to have comorbidity of a number of physical, mental and neurological developmental problems. Anybody with a diagnosis of ADHD, it's worth asking and screening for all of these difficulties because many of them are treatable and improvements in them pointers to whether the treatment plan you're using is being effective and how effective it's being. So now's the time for reflection, and you may want to use your Women's Guide to Adult ADHD Mastery, which you can find free to download on my website drvickycleak.co.uk. So what insights has this module brought up for you and your family in terms of any comorbidities? If you have had comorbidity, perhaps before having a diagnosis of ADHD, what was your experience of the effectiveness of the management for that before you had your diagnosis of ADHD and afterwards? I hope you found this module useful, and I look forward to seeing you at the next video.